Doctors seeing patients over the internet. It's called telehealth. Well, how that new technology is helping doctors connect to more patients than ever before, and how robots are involved in my Watching Out For You report.
We have the lowest number of psychiatrists per capita in the country and one of the highest suicide rates.
Idaho's rate is more than 40% higher than the national average, and in some cases, psychiatrists have a wait time of several months. But telepsychiatrist Kate Lacroix says telehealth is helping to change these stats for the better. Dr. Lacroix says she'd lose about an hour to an hour and a half of her day driving from clinic to clinic in the Treasure Valley, treating patients face to face.
We can service, 3-4 clinics in one day, whereas driving to each of those sites would be prohibitive.
And the largest health insurance company in the state is jumping on board with this idea.
The greatest need here in Idaho happens to be psychiatric care.
Right now, Blue Cross of Idaho doesn't offer telehealth coverage to insurance holders, but the company does have a pilot program in place to test the waters.
We're very supportive of telehealth. We think it's going to be very important, particularly in Idaho, where there's many rural areas that lack medical services.
One of those rural areas is Chalice. The Chalice Area Health Center provides basic care, but there's no mental health provider in the county, and there's not even a hospital close by.
We're an hour from the closest rural hospital along a windy river road. We are 2.5 hours from the closest secondary hospitals. So whether it's weather or finances, the cost of traveling to see specialists and the time it takes is very daunting.
Kate Taylor tells me they're hoping for a grant to help them secure funds for the technology to start a telehealth program. And one of these would help greatly.
In 13 locations around the state, they have robots just like this,
where urban specialists can consult directly with patients in more remote areas throughout our state.
It's almost out of a different century, but St. Al's has had these machines for almost a decade. And they're not just used to diagnose and treat people with psychiatric conditions. The robots allow several different specialists at the hospital here in Boise to see directly into patients' rooms across the Gem State. Each robot is equipped with a stethoscope and jacks to plug in a variety of diagnostic tools. It also includes a phone and headphones so doctors in Boise can communicate with the healthcare provider who's with the patient.
Do you find that they respond well to you through the robot?
Yes.
Dr. Clark helps those who have suffered acute strokes. On average, he and his team use this technology about twice a day. He says the robots are obviously not as good as being there in person.
It's difficult to see things like reflexes or explain to the patient sometimes what you want them to do when you're not present in the room with them.
And he says it's not for every specialist. You certainly wouldn't want a surgeon to treat you behind a camera lens. But for Dr. Clark's stroke patients who are losing 2 million brain cells a minute, he says this technology can help save his patients from major brain damage.
Well, several other health insurance companies say they will start providing telehealth coverage or already offer it. A spokesman for Regions Health Insurance says they've filed to offer it January 1st of next year. The VA says they already cover telehealth, and Pacific Source says they cover telemedicine if services cannot be provided through an in-person visit.